Hello, Regent Park. Welcome to the Downtown East radio show. And we are here with another amazing topic today. And we had our last shows saying monkeypox with the Dr. Aisha. And I thought that was a great introduction to people and information. And today we're here to talk about Wellness Hub. I have two guests here, which is Abhishek and Anu. Welcome, guys. And can you introduce yourself, Abhishek?
Sure. Thank you, Murshida. Hello, everybody. My name is Abhishek. I am working as Pandemic Program Manager for Regent Park CHC, and I've been overlooking vaccination efforts on behalf of Regent Park since 2021. We have been catering to Regent Park, Moss Park, St. Jamestown, Church Young Corridor. We've partnered with multiple organizations in setting up and improving access to COVID-19 vaccines for the residents in these neighborhoods. And our vaccine clinics are now evolving as wellness hubs, so which is what we'll be talking about today. Thank you.
Hi.
Hi everyone, thanks Murshida. So I'm Anu, I'm resident of St. Jamestown from downtown East, and I'm working there in the St. Jamestown Community Corner as a community ambassador since the pandemic. So we are serving there. I work there as a vaccine ambassador as well. I work in the other health related services as well. So we are working there and supporting the residents to get their doses and breaking down the barriers to access the vulnerable and marginalized residents. Currently I'm working with the wellness clinic to support the residents after pandemic. Thank you.
Oh, thank you, guys. It's amazing. Work you guys doing in there. And Abhishek, can you clarify what is Wellness Hub?
So as I just introduced, these wellness hubs are a developed version of vaccine clinics, or we can also say vaccine clinic version 2.0. So what we are trying basically is to provide spectrum of services under these vaccination clinics, which were working as standalone vaccination clinics. So the idea is basically to develop that vaccine clinic to provide spectrum of COVID-19 services that would include vaccination, testing. So right now we are actually focusing on distributing rapid antigen test, and because we have so many pharmacies available in the neighborhood who can do PCR, so we're not focusing on PCR at this point of time, but this is something we can take up going forward. And the third part is therapeutics. So therapeutics is basically other options available to people, like pills when they have symptoms of COVID and they are not they don't have willingness to get vaccination. So basically, what other forms of therapeutics can be used? So developing one side of it, providing COVID-19 services from there, and then adding other services. So what other services are there is basically we will try to see to develop primary care attachment. So clients who does not have family doctors. So we are trying to connect within downtown East, so within all these neighborhoods, to see if we can find family doctors who are accepting clients, and then this way we can try to connect some of the clients. Another aspect is also we are looking into preventative services. So that's blood pressure check, diabetes check, right? And also trying to work around and see and provide mental health support, because so the idea was basically to provide a spectrum of services under one umbrella of wellness hubs. And this is also because a lot of people had trouble during the pandemic to access their family physicians, because a lot of in-person services were kind of closed. There was long waiting times. Not everybody was accepting clients. So this was an initiative which was recently proposed by Ontario Health Teams to evolve vaccine clinics into wellness hubs, so that all these services could be provided to the client. So we are right now it's just we are starting on developing the clinics. So we'll let you know more as we go forward about the services offered and all there. But this is the idea, to bring everything under one umbrella, and we do not want to duplicate any service. It's just that we try to partner with multiple organizations and effectively use the services that are being offered. So we also have that in mind, that we do not duplicate and use our resources effectively and efficiently.
Oh, thank you. So basically, you guys want to do people who can't find a family doctor, people go through the long COVID and everything. You want to give them the support and what they needed, and then that help they have that sort of a service and support them, and then they could come without an appointment. Am I correct?
Yes, that's correct. So they could come without an appointment, but yes, it's basically for when we talk about eligibility, probably we'll let you
Okay.
know more who is about our target population and how does it work. So
Thank you. Hi, Anu. Welcome to the. I'm pretty sure this is your first time to the show.
Yeah.
But thanks for coming. I'm wondering, is it what are the services in the hub you provide?
Yeah, sure. So apart from the COVID vaccination, we are providing providing the cancer screening test like pap test, breast cancer screening, and colon cancer screening. And we are offering the catch-up vaccinations for childs and adults as well. And apart from that, we are doing like preventive checkups like BP check, cholesterol check, and blood sugar checkups. And we are also providing the mental health checkups, and we are providing the supports for the mental health.
Okay, so all these services, people just can come in and then just take it without an
Like for
appointment. Am I correct?
like cancer screening and mental health, we highly recommend to book their appointments.
Appointments?
Yeah.
Okay, thank you for that. That kind of give a little clarification to the community, and then when they come in, what to expect and everything. That's what we're trying to do here. So who's targeted population?
So the target population right now, as I mentioned, we are developing this vaccine clinic. So for COVID vaccination, anybody can come and get their COVID shots. For other services, it's basically we are targeting people who do not have a family doctor, or they have a family doctor but they are not seeing their clients for last so many months, so they have like a breakage in the chain of providing services. So that's basically the target population we are looking into. So because the process is evolving right now, it is a little difficult because we are connected with partner organizations, right? So right now we are trying to figure out how we can support other populations, suppose people who do not have any status. It's like at our end we can take them, but then if there is a red flag in any of these, or if it needs follow up, then probably the question comes, because they have no status, how would we take them? How can we refer them to other partners or other organizations? So that is a bit challenging at this point of time. But right now, as I mentioned, probably people who are in long waiting lines, and people who do not have a family doctor, and so that's pretty much the population we are looking at. For COVID services, anybody can come get a rat kit, anybody can come get COVID vaccinations. So that's the idea, but we are working on evolving how can we support other population as well.
Okay.
Because right now it's in pretty much early stages of development.
Okay, so that's why I was going to ask you, who's the targeted population? Is there any boundary thing, like you guys look into it, you know? So if you could elaborate on that, that would be great. Who can come and get the service?
So right now, as I mentioned, people who are living in Ontario, example, homeless people, they do not have any access to any of the services, can come. People who have been on long waiting lists to see, because either their family physician closed their practice, or they didn't see their physicians for 6 months or so. Just wanted to clarify, it is not a walk-in clinic. It's just that we are trying to help that population who really needs services and doesn't have anywhere to go, right? So we can try to see, because we are also restricted in terms of our resources and our eligibility, but we will try to accommodate as much as we can. And that's why this initiative come across, and that's why we are also partnering with multiple organizations to look into these services. So right now, Sherborne Health and Regent Park are leading this initiative in the whole downtown east neighborhoods. So if that helps, that's it's evolving, and that's why like it's a little bit complicated at this point of time. But hopefully we'll get better as we evolve and have more partnerships within the community.
Oh, thank you. Thanks for telling that. How about there's a newcomer that population as well? Are you guys able to?
Absolutely.
Okay.
So newcomer population is definitely someone who can come and access the vaccine clinics, because newcomers don't have a family doctor. They have recently come and landed. They do not know where should they get the resources, right? So we can let them know. We also try to, as I mentioned, see like which family physicians are accepting clients at this point of time, and try to tie them with those in the neighborhood. So yes, newcomer population is definitely welcome to come and seek services.
And I would like to add one point regarding the newcomers. Like, we are not offering just the health services. We are offering them some support services like employment services, or like if they need a referral for employment, housing, or newcomer settlement services, we are providing that support services as well.
Oh, thank you. That's a great information. So what kind of gap have you seen in this while you're serving these community?
So basically, we saw that because of the pandemic, first thing was people are not able to access services because it was closed. Health system was very much strained. People were burnt out. So there was kind of a deficiency from the provider side. So that's why government recommended this model to come up with everything under one roof. And for our neighborhood, as Anu mentioned, we are also targeting the social side of it. So not only the medical, but the social side of it. So employment is something, if they are looking for employment, they can connect with us. We have partner organizations who can train them, who can connect them with employers. Homelessness again is something like if the client does not have is going through the period of homelessness, they can come. We'll try to work around with our partner organizations, see what can be done there. And one important thing is mental health support. So we do have trained physicians on site who are providing CBD sessions to the clients. So that's again a service. So we are trying to make it pretty much holistic, so that if somebody needs any kind of support, either we provide it or we can refer it to an organization who can support them in accessing those services, and makes everybody's life easier.
I think that's a great idea. Sometimes the people who are trying to do things themselves, and that they struggle a lot. They don't know where to go things and get the stuff and stuff like that. And then having an extra support and then providing that and then going in the right direction. I think that's amazing service that you guys providing, and thank you for that as well. Anu, where can we find all this information?
So right now you can find it on the Regent Park's website, like where is our clinic located. One is at 40 Oak Street and another one is at 200 Wellesley Street East. But for the booking and everything, you can find that information. And we are updating the booking slots and everything. Okay. So you can find that information on website.
On the website.
So
what if a person who doesn't have a web but can't access internet, is there any way they could call in?
Yes. So few things to add to Anu's point. As we mentioned, we are still developing this vaccine clinics into wellness hubs. So it's in the process of being upgraded and publicized everywhere. So right now the clinics are running at 40 Oak Street, as she mentioned, and so the 40 Oak Street is run by Regent Park CHC. Other site, which is at the corner, that's 200 Wellesley, is run by Sherborne Health. And at 40 Oak Street, we are just providing COVID vaccination and rat kit distribution at this point of time. Whereas at the other side, which is 200 Wellesley Street, the corner, all the other services that we have mentioned are being offered at that site. And the information will pretty much be updated soon on the website of Regent Park, Sherborne Health, and St. Jamestown Community Corner. For people who do not have computer literacy, we are trying to partner with organizations and distribute our flyers so that people can come and seek services and support they need to. Also, for the corner, there is a number they can call, and they can book their appointments from there. For COVID vaccinations, they can book the appointment by going to, at this point of time, Regent Park CHC's website, and there is a booking link, and they can choose from both the sites, either 40 Oak Street or 200 Wellesley Street, whichever is easier for them. But right now, because the demand is not that much, so we are also accepting walk-ins for COVID vaccinations.
Thank you. That's a great information. I think we could provide those information on the bottom of our website, and please follow. Please take that numbers, and then please call them if you guys need that support. And then thank you. Really, thank you so much for this information. I think really useful for our community. And as I said that we mentioned about the employment issue, and then I know our women's in the community, we are struggling a lot with the COVID, and a lot of people who lost their business and everything. But Regent community is supporting a woman's entrepreneurship, which is called Moonlight Market. So bunch of women, they're coming together in Daniel 585 Daniel Spectrum to do their business, and I would like everybody to come and support that initiative. And then you also want to be part of it, please connect with one of the coordinator as well. Please come and visit every Thursday and Saturday, 5 to 10 o'clock. And then if you wanted to be part of that group, or you want to support them as well, thank you.
Thank you.
Thank you so much.
Make sure to like, comment, and subscribe. And when you do subscribe, hit the little notification bell so you never miss out on any of our content. If you'd also like more, you can find us on our other social media platforms. And if you want even more, you can look at our website.